Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Epigenetic blood markers reveal dementia risk. Insights from two linked studies. Two new studies linked to the journal Alzheimer's and Dementia reveal that epigenetic markers in the blood could be useful for understanding dementia risk. Researchers conducted a study on the role of DNA methylation and epigenetic marker in exploring how genetic and lifestyle factors impact dementia risk. DNA methylation involves adding a chemical tag to DNA to regulate gene activity, turning genes on or off. Variations in genetic and lifestyle factors can modify these DNA methylation tags, with some factors already recognized for their potential to increase dementia risk. By evaluating DNA methylation patterns, researchers can gain insights into how these factors affect dementia risk and the underlying mechanism that contribute to the disease. Prediabetes and diabetes linked with accelerated brain aging, study reveals. A new study published in the journal Diabetes Care has found that type 2 diabetes and prediabetes are linked to accelerated brain aging, and also a healthier lifestyle could prevent brain aging in diabetes. Type 2 diabetes is recognized as a risk factor for dementia, but its impact on brain aging in individuals without dementia, including those with prediabetes, remains unclear. A recent extensive brain imaging study reveals that both diabetes and prediabetes are linked to accelerated brain aging. The study analyzed data from over 31,000 individuals aged 40 to 70 who had undergone brain MRI scans. Using machine learning, researchers estimated brain age relative to chronological age. Smoking, a major contributor to stroke risk, study finds. In a recent study published in BMC Public Health, researchers assessed the impact of smoking on the prevalence of stroke. They explored the relationship between smoking-related factors and stroke risk, while also analyzing how demographic differences might affect this association. Stroke results in significant illness and death globally and can be classified as either ischemic or hemorrhagic, arising from damage to the brain's blood vessels and tissues. The risk of stroke is associated with oxidative stress, inflammation, autophagy, and apoptosis. Elevated smoking risk, familiar smoking habits, and high level of harmful tobacco components such as carbon monoxide, nicotine, and tar all increase the risk of stroke. These factors reflect both the level of exposure to smoking and the frequency of smoking, as well as the potential harm inflicted by inhaled smoke. WHO reports major Chandipura virus outbreak, largest in 20 years. A major Chandipura virus outbreak have been reported in the Gujarat state of India, which is considered the largest in 20 years. WHO recently stated, Chandipura virus is a virus from the Rabidoviridie family that causes sporadic cases and outbreaks of acute encephalitis syndrome in parts of India, especially during the rainy season. It spreads through the insects like sandflies, mosquitoes, and ticks. In Gujarat, the sandfly Phlebotomus papetaceae is known to carry the virus. The disease often has a high death rate ranging from 56% to 75%, especially during the outbreaks in India. As per the WHO, from early June to August 15, 2024, the Ministry of Health and Family Welfare of the India reported 245 cases of acute encephalitis syndrome, with 82 of those cases resulting in death, giving a case fatality rate of 33%. Out of 245 reported cases of acute encephalitis syndrome, 64 have been confirmed cases caused by Chandipura virus. Among these 64 confirmed cases, 61 were reported in Gujarat state and 3 in Rajasthan state. Since July 19, 2024, there has been a daily decrease in the number of new AES cases. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.